Somewhere in your kitchen, there's probably a bottle you've been taking for years. You started it for a good reason. It helped. And you just kept taking it. A little white pill that became part of the furniture of your life, that no one ever told you to stop, to lower, or even to check on again. The prescription got refilled, the months turned into years, and the question of whether you still needed it quietly never came up. Here's the thing about some of the most common medications people take. They were never meant to be taken forever without a second look. Not because they're dangerous villains. Most of them are genuinely useful, but because taking them for years can quietly do things that taking them for weeks never would. By the end of this video, you'll know 4 of the most common ones, why the long-term picture is different from the short-term one, and exactly what to ask your doctor about each, not to frighten you, to make you the kind of patient who keeps the good and questions the rest. Before I say a single word more, let me be completely clear, because this matters more than anything else in this video. I am not telling you to stop any of these. Please do not stop a medication because of something you heard online. Not this video, not any other. Some of these are keeping people safe, and stopping the wrong one suddenly can be far more dangerous than staying on it. What I'm giving you is different. I'm giving you the questions, the ones a good doctor is happy to be asked. Because the goal isn't to quit your medication. The goal is to make sure that every pill you take every day still earns its place. So bring these to your next appointment, not to your trash can. The first is a class of stomach medications called proton pump inhibitors. You might know them by the little purple pill or names ending in prazole. They turn down stomach acid powerfully, and for ulcers or serious reflux, they can be exactly the right tool. The catch is that they were largely designed for short courses, a few weeks, maybe a couple of months, and millions of people end up taking them for years, sometimes for symptoms that have long since passed. Over the long haul, lowering stomach acid that much can make it harder to absorb certain nutrients, like vitamin B12 and magnesium, and long-term use has been studied in connection with bone and kidney concerns. The conversation to have with your doctor is simple. Do I still need this? At this dose? After all this time? And if we taper down, how do we do it slowly? Since stopping suddenly can cause a rebound of acid that feels worse than where you started. For many people, the honest answer is that they still benefit and should stay on it. But for many others, it turns out the bottle has simply been refilling itself out of habit for years. The second is hiding in your medicine cabinet right now, and most people don't even think of it as a real medication. Over-the-counter sleep aids and the PM or nighttime versions of pain and cold remedies. The ingredient that makes you drowsy is usually an older antihistamine, and it belongs to a group called anticholinergics. For an occasional bad night, that's one thing. But taken night after night, year after year, especially as we get older, this group has been studied in connection with memory and thinking problems. And the research has been concerning enough that many doctors now steer older adults away from using them regularly for sleep. The question to ask, if I'm reaching for something to sleep most nights, is there a safer approach for someone my age? Because the goal of good sleep is right, it's just the long-term tool that may need rethinking. The third is the one almost everyone has taken, the common anti-inflammatory painkillers, the ones you grab for aches, headaches, and sore joints. For occasional pain, they're reasonable, but taken daily over long stretches, This group can quietly irritate the stomach lining and cause bleeding, can strain the kidneys, and can nudge blood pressure upward, which is easy to miss because none of that announces itself. Many people take them every single day for chronic pain without anyone keeping an eye on those effects. The conversation, if I'm relying on these most days, what's the safest amount for me? And should we be checking my kidneys and blood pressure while I'm on them? And is there a gentler way to manage this pain that doesn't ask my stomach and kidneys to carry the cost every single day? The fourth one has genuinely shifted in recent years, which is exactly why it's worth raising. For a long time, a daily low-dose aspirin was treated as something nearly everyone over a certain age should take to prevent a first heart attack or stroke. But the guidance has changed for many people who haven't already had one of those events, because the bleeding risk can outweigh the benefit. And I cannot say this strongly enough. If you've already had a heart attack, a stroke, or a stent, your daily aspirin may be doing essential work, and you must not stop it on your own. This is the most important ask, don't quit, of them all. The question is simply, given my personal history, is daily aspirin still the right call for me? Or am I taking it out of habit from advice that has since moved on? It's a 5-minute question that, for the right person, genuinely changes the math. Now, take a breath, because I don't want you walking away anxious about the pills on your counter. The point here isn't fear. It's a single good habit, a medication review. Once a year or so, sit down with your doctor or pharmacist. Bring every bottle you take, including the over-the-counter ones, and go through them one by one. Does each still have a job? Is the dose still right? Is there anything we should be monitoring? That one conversation is one of the most powerful, underused things you can do for your long-term health, and a good doctor will be glad you asked. You're not being difficult, and you're not second-guessing your doctor. You're being a careful steward of your own body, and that's exactly the patient every good doctor hopes to see walk through the door. Write your questions down before you go, because it's easy to forget half of them once you're in the room. So, if you remember one thing, no medication should run on autopilot forever. The 4 we talked about, the acid reducers, the nighttime sleep helpers, the everyday painkillers, and daily aspirin, aren't villains. They're just worth a second look with your doctor, not on your own. Bring the questions, keep what you need, and let go only of what you don't, together. If this helped, leave a comment and share it with someone who's been taking the same pill for years without a review. And tell me, how many bottles are in your cabinet right now that no one has actually checked in a long, long time?